This video lesson is going to be looking at the OCD characteristics. So OCD can be characterized by really obsessions and compulsions. Obsessions cause anxiety, compulsions are there to relieve that anxiety. So, as I just said, obsessions are really reoccurring thoughts or images that occur in someone's mind, and they cause someone a lot of anxiety. And in order to deal with that anxiety, people with OCD have compulsions, and they're usually repetitive behaviours. If you think of a typical OCD person, you'll probably imagine someone excessively cleaning. So the obsession there is the fear of germs, this thought that germs are going to attack them, that they're going to become ill. And that's what causes anxiety. And the compulsion in that case is excessive cleaning, that repetitive behaviour that they do over and over again to reduce their anxiety levels. And let's remember, for this specification, you need to know three things: behavioural characteristics, how we act when we have OCD, the emotional characteristics, how someone feels, and the cognitive characteristics, so how someone processes information or thinks while they've got OCD. So the first thing we're going to have a look at is the behavioural characteristics, and these are the compulsions, the compulsive behaviours that people show, because it's basically how they act. So these are always external behaviours. They're something that someone is doing in response to the anxiety caused by the obsession. So they are usually repetitive actions, and people feel the need to do them over and over again. It might be hand washing, as we've already said. It might be lining things up in parallel lines for symmetry OCD. But it's something they feel the need to do over and over again. And also, these are done to reduce the anxiety caused by the obsessions. So if someone is hand washing all the time, that repetitive behaviour, washing their hands over and over again, that's done in response to their fear of germs, the fear that they're going to get ill because of contamination and because of viruses, bacteria around. They wash their hands to prevent that happening. And that reduces their anxiety levels, and they're able to get on with their day a little bit better. Another behavioural characteristic that's very common in people with OCD is avoidance. So they'll avoid any scenario, any situation that is going to cause their OCD and their compulsive behaviours. So for example, someone who's afraid of germs will stay away from anywhere dirty. They might not visit zoos, they might not visit anywhere that they know isn't going to be very clean. So that will prevent them from actually having to carry out their compulsive behaviours. So avoidance behaviour is very common in people with OCD. So the emotional characteristics of OCD are how someone feels when they've got this particular disorder. And the main one is anxiety. And if you remember, anxiety is caused by the obsessions. The compulsive behaviours are there to reduce the anxiety, but the anxiety itself is caused by these reoccurring thoughts and images. And they're usually pretty frightening, they're unpleasant, because it brings about an overwhelming feeling of anxiety. It's something that takes over your whole life, can take over that particular part of your day. It's not just like low levels of anxiety, this is an overwhelming level of anxiety that really interferes with their everyday life. In addition, they're going to feel other emotions. A lot of people who have OCD become depressed, so they have exceptionally low moods. And compulsive behaviours, such as hand washing or flicking a light switch, can bring about temporary relief for this. However, low mood is a big characteristic of OCD. In addition, they feel embarrassed. A lot of people with OCD understand that their behaviour is excessive. It goes beyond what most people do. Most people don't wash their hands 100 times a day, flick a light switch on and off 25 times before they leave a room. And this awareness can bring about embarrassment for people who have OCD. So the cognitive characteristics are all about how people with OCD process information. And a lot of OCD can be linked to irrational thought processes. And what we mean by that is they're things that normal people won't think about. So for example, 90% of people who have OCD actually have obsessive thoughts, these reoccurring doubts, images, thoughts going through their mind all the time. Remember, this is what causes the actual anxiety, that emotional response. And these are all internal, so they're all going on inside the person's brain. And each person with OCD might have their own different irrational thought processes going on. And they're never pleasant. These are always unpleasant thoughts. They might be thoughts about germs. Some people have fleeting sexual images going through their brain. Some have the impulses to hurt other people. So they're always unpleasant for a person. And these thought processes are the cognitive characteristics, because it's the actual way they're processing information is different to everybody else. It's irrational. And sometimes people create cognitive strategies to deal with these obsessions. So if you think about a religious person who's tormented with guilt. So they've got this irrational thought process already going on. Guilt is processing and going through their mind all the time. They might deal with that by using prayer. So in their mind, they'll be thinking about and using a cognitive thought process. They'll be thinking about God, and they'll be thinking about praying to God to help them with this guilt. And that internal process of praying is a cognitive strategy, and it helps them to deal with their obsessions and deal with the anxiety that's occurring. And also, they are always aware that what they're doing is irrational. Okay, this is really necessary for diagnosis, and it makes OCD different from other disorders such as schizophrenia, where people aren't aware. So in schizophrenics, they're not aware that their behaviour is excessive, whereas in OCD, they're completely aware. They're aware that what they're thinking isn't normal, that sometimes what they're doing has no relevance whatsoever to the actual scenario. Some people have to flick a light switch 20 times a day just to make sure that their family doesn't die. Okay, there's no link between the two things, but that's one of the key things for a diagnosis in OCD. They've got to be aware that their thoughts are irrational.